Everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Welcome to our Monday's Q&As. This is a place where I answer you direct and specific questions as long as they can be generalized to the rest of the audiences. So if you do have a question that is specific to your situation, feel free to email it to me, info@drzphd.com. My email is also below in the information box down below. As always, I keep everybody's names blocked out for privacy reasons, and I randomly select 6 questions based on the time that appeared in my Q&A folder. So I'm really excited to get started. I have 6 questions. I haven't looked at them yet, so let's get going. First question for the day. Also, I'm not sure if I mentioned this. My brain is a little bit foggy today. There's going to be timestamps in case if you want to jump around based on the topic of interest or relevance to you. So first question for today. Like you need another person questioning you about topics. I have no problem if any of you want to question me about topics. I have a quick question about how to determine if your support group is really supporting you or if they're just blowing smoke up your skirt, so to speak. Please, thank you. This is actually a really good question. How do you know that people around you truly are being honest with you, ideally objective with you, especially when it comes to asking them for advice, asking them for feedback on perhaps maybe appearance and how you look, how you present. It becomes, for people for whom passing matters, it can be really, really important form of feedback and advice. So how do you know that people around you are honest and not blowing smoke up your ass? Well, the truth is you sort of don't. Unless you are a mind reader or you have an incredibly good bullshit meter, so to speak, you really don't. And the best you can do is you can trust that people around you have your well-being at heart. They really intend well, and they're not there to really just, again, lie to you or be inauthentic or be dishonest with you. One of the things that I would say to kind of maybe perhaps look out for is that if people in your life consistently giving you praise and appraisal and never giving you any constructive criticism, that's the only area perhaps to think about or to even ask them. I noticed you always give me incredible praise, always super positive, but there's got to be some constructive feedback you can give me. So that could be a way of opening up the conversation, especially if you have people in your life who are just afraid of hurting your feelings. But there's really no way to tell. You just have to trust your intuition. You have to trust whether it feels authentic. Sometimes we all can tell when somebody really is exaggerating their praise or when they're not being honest. And sometimes it can be really difficult to tell that, especially if dysphoria is something that gets in the way. It can make things very complicated. It can really kind of make your otherwise a really good bullshit meter that you may have with other people. When it comes to dysphoria, it may really make it challenging. So yeah, there's really, you just got to trust and find one person in your circles that you know can give you constructive criticism, and perhaps use them as some kind of baseline or some kind of a way to then assess all the rest of the praise you're getting. But this is a really good question. Question number 2. Dear Dr. Z, I'm a big fan of your YouTube channel and work, but I have a question. Great. This is what Monday's Q&As are for. Is it possible that someone is a trans enough so she has few trans memories from childhood? Is it possible that childhood original gender identity was repressed and comes to the surface again after 30 plus age? By the way, I am assigned male at birth who is transitioning. So this is a really good question. It's a question that a lot of people tend to wonder. I have a video on this. I have a short, one of the short 60 seconds or short snippet on this as well. And I believe the video that I have is called "What If You Don't Have Any Childhood Memories?" So if you are listening to this and you're someone who asked this question, please find that video. It will explain all of it. But yes, very common not to have childhood memories. Now, a lot of people do have childhood memories, and they distinctly remember at an early age when they first experienced gender dysphoria, and they've been carrying and living with the dysphoria up until adulthood, until they decided to do something about it. Some people, it's not that they don't have childhood memories, they do have childhood memories, but it's just that they haven't really connected uh, understanding of dysphoria to childhood memories. So what happens a lot is that people think they don't have childhood memories, and then as they step into their understanding more about gender incongruency and what exactly is gender dysphoria and how it tends to manifest, suddenly now they're looking at their past through that understanding lens, through that lens of awareness. And as a result, they're starting to realize and they're starting to see that, oh, this over here in the past was actually a sign of gender dysphoria. This was actually me reenacting the incongruency I was feeling. So that's another thing, that people do have gender dysphoria in childhood, but they haven't really connected it to dysphoria until they have an understanding of what dysphoria is in a later adulthood. And then there's a group of individuals who have completely repressed feelings of gender dysphoria, and it tends to come up, like you said, age 30 or up, or even later, where suddenly people feel like, how could it be that I lived all my life not feeling any incongruency, and then suddenly now I do? That is also common, that also happens. We're all human beings, and we all have our own psyche and our own psychology to consider, and everybody is different, and our psyche is very it's very strongly rooted and in a strong proximity and in relationship to the context, to the environment, to the upbringing, to a lot of other things. And so no two people are going to respond to feelings of distress in the same way. Some people are going to respond to feelings of distress by showing actually that they're in distress. Some people are going to respond to feelings in distress by pushing it aside deep down inside and putting a lid on it until that distress comes, until that lid literally pops up when they're older. Very common, happens all of the time. The narrative, the dogmatic old classical narrative that you have to have childhood memories since a very early age, otherwise it's not a gender dysphoria and you're not trans, in my opinion, is deeply inaccurate and not true. And that narrative was never really accurate historically. What happened is that a lot of individuals had to mimic that narrative in order to get access to care. And because a lot of people had to mimic that narrative in order just to get the hormones they needed or medical attention that they needed, clinicians started to think that that's the pattern to the narrative. But that is really very much inaccurate. But great question. And I do encourage you to search my video list, and it's definitely there. Question number 3. I'm a trans woman and I'm a year and a half with hormones and social transition. Recently, I have been struggling as when I talk to or imagine myself, I view myself as my pre-transition, as male. And it's horrible, as I get a real dread, as it's almost like misgendering myself. I want to view myself as female when I view myself. It's really confusing. Confusing band, don't really know how to overcome it, and it's an instinctive feeling. I'm sorry. I want to move on, but it's really getting me down. So this is another really great question about when you're early in transition, when you start thinking about yourself or envisioning yourself, maybe imagine yourself, you're still envisioning and imagining yourself as your, let's say, old, I'll use the word old self, right? The older you are, the longer you have been living in your gender assigned at birth, the most longer potentially you may struggle with envisioning yourself or picturing yourself in your mind's eye as an old self as you go through gender transition. It's just part of the brain that has got habituated to perceiving and thinking a particular way, and it's just about rerouting the brain. It is very common for people to continue to, for example, hear, you know how we hear ourselves having inner dialogue with ourselves, our inner voice in our, inside of our headspace. It is very common for people to still hear the voice, either masculine or feminine, based on how the voice that they utilized in relation to their gender assigned at birth for a long period of time until they finally start to hear their now gender authentic voice. Again, the longer you've been living in your gender assigned at birth, the longer that integration might take place because you got habituated. So you have X amount of years to kind of rework, reround, rehabituate But we're humans, we're incredibly adaptable, and eventually it does happen. I don't know how old you are, but year and a half on hormones and social transition is still relatively early. So it's okay, it's normal. I know it can be very, very jarring, and for a lot of people, it's very jarring when they um, envision themselves, close their eyes, but they see their old selves. It can be very debilitating, can bring up a lot of dysphoria, very uncomfortable, but you just have to keep telling yourself that this is part of brain process of rerouting itself. And you just have to kind of take a deep breath, don't get too upset about it, realize you are in the process. That's part of transition, is also being able to shift the way you orient yourself and the way you see yourself now in relationship to your authentic self, because you lived so many years as gender ascended birth, which I think it's fair to say, was inauthentic sense of self-identity. Very good question. Question number 4. Hello, Dr. Z. I just recently found your YouTube page and was able to find great comfort in your uplifting messages. I'm so glad to hear. As much as all of you know that I can be very like upfront and very honest with you about a lot of pros and cons about gender transition and things like that. I try to do it with lots of heart and passion and optimism, because I just have seen what's possible, and I have just seen how much happier people are. I'm currently in the process of accepting myself as a person who is non-binary. It took me a while to get out of the denial phase, but here I am. Yeah, denial phase. My question concerns gender norms and internalized misogyny. As a non-binary person that is biologically female, I consistently struggle with feeling hatred towards myself, mostly due to societal norms. Unfortunately, I have developed a certain level of toxic masculinity in the same way that men do. I feel very insecure in my masculinity because I feel so imprisoned by gender norms that were forced onto me from childhood on. In addition to that, I experience internalized misogyny as well as transphobia. Both has caused me a lot of discomfort and self-hatred. I do not know how to escape this internal attitude. I know gender norms are toxic nonetheless. It seems so difficult to let this type of thinking go, as it is so deeply rooted in society and in me. Furthermore, this state seems to prohibit me from coming in touch with my feminine side. I think the problem is that I assign a lot of value to how people perceive me. This is actually what causes me the most dysphoria, when I become aware that people perceive me as a woman and not how I see myself on the inside. I have to admit that I have not come out to my broader surroundings, but it also feels like I will never be perceived as the person I am by everyone, as most people only see women or men. This has caused me to isolate from myself from deeper human contact. I seek your advice on how to have healthy masculinity by letting go of gender norms, even though everyone around you follows them, and also overcomes internalized transphobia and misogyny. Thank you in advance. I feel like we already had this question on here for some reason. I wonder if perhaps the viewer has emailed me twice and I just snatched it in, but it sounds very familiar. One of the things that I want to say, and maybe this is somebody else struggling with the same issue. One of the things that I want to say is that what I hear in this message is, and you yourself acknowledge in this message, how much others people validation of who you are and the way they see you matters to you. I think external validation, of course, matters, right? We don't exist in a vacuum. So to some extent, it's important for us to be validated externally by other individuals. Nonetheless, I think it's also important to realize that you really have to first give that validation to yourself. And to some extent, that validation external has to matter, but you should not be dependent on it. So do you see the difference? So it's great to get it, but your world should not fall apart because you have not received it. This is where the dependency part becomes very tricky, and this is where you don't want to become dependent on external validation. Now, when somebody's struggling with misogyny, and on top of that, toxic masculinity, and on top of that, internalized transphobia, it becomes a combination that it's possible to dismantle all of that. And I would highly encourage for you, if possible, to seek individual therapists in your area to help you dismantle all of the things. All of us are layered with societal constructs, societal perceptions, not only of gender norms, but also of gender behavior, gender etiquette, gender, you name it, right? We're all inundatedly um, layered by some. None of us can escape it, regardless of how we feel about our gender. I can't escape societal norms of what it is to be a woman, of what it is to how my femininity should be presented, how my femininity should be vocalized, even, right? So there's even ways that I speak that, to some extent, some people might say is too outspoken, right? A woman that is outspoken is suddenly a bitch comes to mind. So we all are inundated with the societal things, and it's really important to be able to understand how those things become shaped up in our society, and how, while they become part of society, they don't have to become part of you. And that there's a lot of people who struggle with that, and not everybody sees gender norms and gender presentations and gender constructs through the same lens. But it is possible to dismantle it, and it is possible to get in touch with a healthy masculinity within yourself. So I would really encourage for you to find somebody local to work with, to help you dismantle all of that, to find out how you see masculinity, because the way you're going to see masculinity is going to be different the way I see masculinity. And it's not going to be that one is right or wrong. It's just going to be personalized based on our experiences, and that's also an important part of it. So that's what I would really encourage. But it is tough, when there's misogyny, toxic masculinity. um, I think in the where it was similar question, I said I prefer wounded masculinity. um, and not all masculinity is toxic, and sometimes we need to learn to be able to distinguish healthy masculinity from presentations and um, views of non-healthy ones. So I wish you all the best, and this is the best that I can do, because this is kind of like not one answer type of question. Question number 5. Hi, Dr. Z. Wanted to first thank you for your channel. It has truly been a huge emotional support and extremely useful source of information for me and for many others too, I'm sure. Thank you for doing what you do. You are so welcome. None of you have ever need to thank me. Um, I can't imagine doing anything else. I really can't imagine doing anything else. I also wanted to ask a question regarding cisgender people. I've asked a couple of my cis friends how they would feel if they were born with a body of the opposite sex. Usually they say it would probably be okay, even if they still slightly prefer their current body. Sometimes it makes me feel like I'm crazy. I experience gender dysphoria, but then I remember that cis people don't experience gender dysphoria. So it's possible they don't actively imagine what dysphoria would feel like, and they might be imagining they would be cis with the opposite sex body. I also remember you or someone else in the community mentioned previously that cis people generally don't think about their gender all that much. Therefore, they also don't think too much about what it would be like to live in the body of the opposite sex. Another possibility is that maybe some of my friends have fluidity and really would be okay living in the body of the opposite sex. Would love to hear your thoughts on this. Thank you. This is a fantastic question. And as a cis identified, I think I'm more than qualified to answer this, at least from my point of view, but also the psychologist, I'd like to shed some light on it. So I'd like to say that, in my opinion, cis people definitely do experience gender dysphoria. I think it's impossible not to experience gender dysphoria. I'm sorry, I'm shaking table. Not to experience gender dysphoria, because we live in a world, as the previous person pointed out, that is so layered with particular inundated concepts about what gender is. Inevitably, it's going to breed in all of us a sense of not fitting in. You're not man enough. You're not a woman enough, even if you're cis and comfortable with it. So there's going to be some sense of not enoughness and living up to certain parameters, living up to certain bar the society sets for us in terms of our role and our gender presentation as well. So cis people definitely, in my opinion, experience gender dysphoria. They don't see it or call it as gender dysphoria because we're so accustomed to hearing gender dysphoria being tightly associated primarily with gender identity as stemming from root incongruency between one's gender assigned at birth and one's authentic sense of gender, right? So we're not so used to hear dysphoria talked about just presentation or just in regards to the role, but they do experience that discomfort. But cis people who are comfortable with their gender assigned at birth don't experience and cannot fathom and cannot even imagine to understand, including myself, is having a deep incongruency um, between gender assigned at birth. And I'm talking about here having a physical sense of incongruency that so many of you struggle with. So we're not talking about social incongruency of not being good enough as a man or not being good enough as a woman as a cis person. We're talking about a deeper sense of physical incongruency. Sure, people struggle with inadequacies, right? Not like in particular body part. We even struggle with being skinny or being not skinny, or being heavy, or being voluptuous, being curvy, not curvy. They struggle with being beautiful, being not beautiful. Men struggle with a lot of things too that they try to live up to. And even though some of those things are aspects of physicality, the way cis people tend to struggle, in my experience, with these elements of physicality are not deeply rooted to gender physical incongruency, right? So again, a very banal example is an assigned female at birth that identifies as transmasculine is going to feel physical distress and dysphoria in regards to their chest, because they will feel that their chest is not only deeply in complete incongruency with how they see their masculine gender, but that it also communicates to society and to the world that this chest symbolizes a woman, a femininity, and that's not what they identify with. Whereas a cisgendered woman that is uncomfortable with her breasts because her breasts, maybe she wants them to be bigger or smaller or less droopy or whatever. It feels uncomfortable because she doesn't think that that's attractive. It gives her discomfort. It gives her physical discomfort, but it doesn't give her discomfort of physicality tied to her gender and tied to the ways the world perceives her breasts in relationship to her gender per se. You see the difference? So for that reason, I think when people say that would be, when you ask and you cis friends and they say that would be okay, I think uh, I want to say bullshit because they really don't know. Look at me. I specialize in this field. I work exclusively only with trans and non-binary folks. So imagine how much of narrative I've been hearing throughout my 17 years of career. Imagine how many examples I have seen throughout 17 years of my career. This is why I'm able to create content and answer questions where a lot of you are wondering and ask me, are you trans, Dr. Z? Because you seem to know us so well. And even though I can empathize really, really well with all of you, because I have an understanding, because I've been listening over 17 years, right? And I'm a psychologist on top of that. I will never, ever fully know what it's like to struggle with gender dysphoria the way all of you do. Never. None of my experiences will ever land me to ever knowing, because to know, you have to have gone through the experience. So for that reason, I can imagine this person saying it's okay because we don't know. They don't know. On top of that, people who are cis, who are comfortable with their gender assigned at birth, take it for granted. It's something that doesn't even enter your mind. So you can't say how you're going to feel about something if you have not only has it never entered your mind, but your mind cannot proceed. It's so hypothetical within the realm of hypotheticals, your mind cannot even fathom it. So you're not going crazy. You're absolutely not going crazy. You also, in my opinion, should not be asking cis people how they would feel because they don't fucking know. This is your experience and your experience is true to you. and your experience is valid to you, and you feel uncomfortable with your gender assigned at birth. And because this person tells you that they would be okay with it, doesn't mean you have to be okay with it. And you're asking somebody who has never ever walked a single step in your shoes. So that's what I would say. It's a great question. But yeah, that's what I got to say about that. Final question for today, question number 6. Now for my question, actually, it's more like two questions. Okay, so two questions for number 6. So first part, is it common or weird for gender fluid non-binary people to only identify as either the opposite gender, opposite of what they were born as, or either or neither binary gender and not the one they were born as? Example, fluctuate between female and non-binary, but not male, and yet be fluid between masculine, feminine, and neutral gender expression. Is it possible? Yes, it's very possible. It happens all the time, because you're talking about gender identity and then you're talking about gender expression. Remember, your gender expression doesn't have to be fixed, or it doesn't have to be in alignment with your gender identity. It can be, but it doesn't have to be. On top of that, I really want to point out to all of you that we still know very little about full formation of gender identity in human beings. We're formulating a lot of hypotheses right now. We're constantly coming up with language to help people understand their experiences. And we still have a lot of language, a long way to go for language to develop to be able to explain all of the other experiences. Now, to the second part of your question, is it normal or common for those people to also label themselves as trans and also still transition medically with hormones, even though they do not socially identify as or always wish to express themselves in a way that is congruent with what is socially associated with the gender opposite of what they were born with? I'm sorry this were so wordy, but there's much more context to my situation, as well as other questions I have that I didn't include because I don't want to take too much of your time. Thank you so much. You're not taking up too much time. They're great questions. So is it possible for people to call themselves trans? Yes, it depends on you. So trans is now becoming a huge umbrella term under which a lot of gender variance clusters. If you see this as umbrella term under which a lot of gender identities clusters, then you can, of course, some people don't see this as umbrella term. Some people say that trans identity or transgender individuals are, for example, completely different gender identity from, for example, non-binary, or from example, genderqueer or gender fluid identity. And it's, I guess, we're in a stages where there's no one right. You have to figure out what feels right for you. But I would say yes, absolutely. And can you still transition medically with hormones, even though you don't really solely identify as or always with the express themselves in a way that's congruent with socially associated with gender opposite of what they were born as? Yes, of course. So stepping into medical transition form of hormones is solely your decision. And hormones are not just there for what I would call binary transgender individuals, meaning people who identify as solely trans women or trans men at the opposite end of a gender spectrum, if you will. We know that a lot of people use hormones. A lot of people use combination of hormones. A lot of non-binary folks use combination of hormones. Sometimes people use hormones for a short period of time until they achieve desired changes that they want, and then they stop. So it's very personal. There are a lot goes, especially if you are going to have a hormone regimen that is going to help you achieve your goals. There's a lot of goes into the discussion with your doctor to find what works best for you. But yes, this is very common, and it depends on what your goals are. It depends on what your gender identity is. It depends on what your gender expression is. It depends on all of those factors. But absolutely, and people do this all the time. And unfortunately, it's not available or accessible in all of the countries. I just had an email, somebody from, I believe it was from Poland, where you can't, if you're non-binary, you can get, for example, microdosing hormones, or you can just get some element of regimen. You have to have either just full feminizing or full masculinizing hormones. In other words, the only pretty much provide hormone care for people who identify as trans-binary, and that's really unfortunate. So it really depends also on the country you're at, but yeah, it's possible, and people do it all the time. Again, depends what your goals are, and you have to be very clear about your goals. I always say that for people who are non-binary, gender fluid, hormones can become a little bit more of a tricky thing, only because it's you can't just cherry pick what you want on hormones, and sometimes there's going to be that kind of pros and cons figuring things out. But great question, and great questions from everybody for today. Those of you who are watching, chime in if you have any feedback for these individuals, any support. If you have your own questions that are specific to your situation that you would like to get my 2 cents, if you will, on it, feel free to email it info@drzphc.com. And I'd be very happy to include it in Q&A folder. As always, love reading everybody's comments, and I hope to see you all next time. Bye.